Today we have Mac, who's a 12-year-old mixed breed dog who is a good example of a typical 12-year-old dog who still enjoys life but has the wear and tear of a good life. So we're going to demonstrate passive range of motion and just some gentle massage on a dog that has stiffness, which is far different than a dog that doesn't, the way we address them. So first, the most important thing is to get yourself in a good position so that you're not stressing or straining, because the dog cannot relax if you are not relaxed. And so I'm just doing some skin mobilization. Gentle, this broad open hand, moving the skin, which stimulates blood flow and nerve activity in the fascial system, which is wrapping around the muscles and the bones and the entire body, and it's very, very relaxing. And if the dog is not appreciating it, it's one of two things. That most of the time it's because you're being too rough or using too much pressure. So then you just lighten up your pressure. And then the other thing is that if they just didn't get relaxed, and just because we have in our agenda, we're gonna relax you today, we have to get them in the mood, so to speak. And almost always starting with their head and their neck, just like for us, helps them to relax. Good boy, Mac. Okay, so we're gonna work on the forelimb first, and I'm just gently stroking as I can feel Mac's not completely relaxed yet. And there's three main joints of the forelimb. We have the shoulder, which is up here, the elbow, which is like this, and for us, oh, it's okay, Mac, good boy, and the carpus, which is the wrist. Most older dogs have some arthritis in their carpus. It's just a little bit stiff. So we're gonna start by just gently motioning it, not trying to get a really good stretch. It's what's comfortable for the dog. Joints rely on movement within them to get blood flow and oxygen and nutrients. So there's a lot of benefit to just moving the joint. And then we're going to keep our hands open, because no one likes to be grabbed or pulled. So you don't want your hands closing, because as humans we tend to pull when our hands are closed. So we're just straightening the limb by pushing with my right hand at the elbow and gently pushing with the carpus just to bring it into straightness. And take a deep breath, and then gently bringing it into flexion. And I'm not bringing it into significant flexion, just what is easy for Mac. And sitting with it, and then pushing it into straightness, and then bringing it back into flexion. More flexion at the elbow than at the carpus. Some dogs have a lot of elbow arthritis, so we just have to be cognizant of which joints have more issues, and also feeling. And then you can feel the animal get tenser if you're pushing it. So we are not trying to have a goal of having a particular degree of flexion, just what's comfortable. So then we have our hands open and straightening the limb, and then we'll gently pendulum forward, extending the shoulder with the limb extended, and sit with it. Good boy, Mac. What a good boy. And that's quite a good extension. And then we'll pendulum back, and that puts it into shoulder flexion, but we still have an extended elbow. Good boy. That's fantastic. And we want to stay in the plane of his body, so we're not lifting up and we're not torquing or rotating down, just in the same plane of the body. Gentle pendulum. And that moves the whole shoulder blade. and then gently go back into flexion again, and then push open. Okay, we're going to focus on Mac's hind limb. He has had cruciate injury or stifle injury to this hind limb. So he wears a custom orthosis or a custom brace, which obviously he's not wearing right now. He's very tight up in his adductor and hip area because that's just a consequence. When your knee hurts or any joint hurts, you pull it closer to your body. So I'm rubbing just gently, open-handed, kind of massaging on the outside of his hip and on the inside of that muscle. And that's fine that he's sitting up right now. And you can see that the leg is just getting straighter and straighter, just a matter of relaxing. Okay, so for Mac's hind limb, we have 3 joints: the hip joint, the knee joint or the stifle, and the tarsus or the ankle. And first we relax the leg, and we've been working on his leg for a little while now anyway. And the adductor, which is the muscle in here, was very, very tense. So first we relax that muscle. That's more important to relax the tense muscles than to get a particular range of motion. And then I leave my hands open, and on the stifle and the tarsus or the ankle, so the limb goes into straightness, and then I'll slide my hand down and bring the limb into flexion. So we have a flexed hock, a flexed knee, and a flexed hip. And just hold it there for a minute, taking a deep breath, and then slide and go ahead and straighten it again. And then we'll pendulum forward with the limb straight in extension, but this is flexing the hip joint. And then we'll gently pendulum back. Most older dogs are a little bit tight for hip extension, and it also requires spinal extension. So I'm just gently holding. Good extension, Mac. Excellent. And bring it back to center, and then come back into flexion. Again, not forcing the joint or trying for just a little more. This is all about range of motion, having the joints massage and increase blood flow of themselves, and mobility and relaxation. Here we go, Mac. You did a fantastic job. Yes.